Okay, so today's injury breakdown is on strokes, and no, athletic therapists do not treat stroke symptoms in the clinic, but we do address them at sporting events because we are first responders and the medical staff on site. So if an athlete or a individual present at the event ends up having a medical emergency, we are the medical staff that are there assessing and making the decision whether we need a higher level of care. So what does it mean to have a stroke? Basically, in the simplest form, your brain isn't getting enough blood supply, and your blood carries oxygen. So if you don't have oxygen to your brain, you can't function. And so our body's really picky. So if it doesn't get everything it needs, it kind of shuts down. And so there is a simple acronym if you want to remember stroke symptoms or to assess for one, is FAST. So F is for face, get the person to smile. If when they smile half their face droops, that means they're experiencing a stroke. Second part is arms, so get them to raise both arms up. And if one arm is drooping down or they can't lift it and it's on the same side where the face is drooping, that's telltale sign. Third part is S, so get them to speak. If when they speak or they attempt and they're incomprehensible or it's all gurgled and you just have no clue what's going on, move on to the next one, which is T, which is for time. So promptly call 911 and get them going because they will have the tools and means to address someone experiencing a stroke. So if it's just you and you call 911, great. How do you take care of them? Make sure there's nothing in their airway, and that they're able to breathe. Obviously, if they're awake then they have a circulation. And if you want to keep them in a position of comfort, if they're on the ground, then put them in the recovery position where you have one arm where they're laying on their side, the one arm is on the ground like so. Their head is then cradled with the opposite arm, so it's going to come across like this. And then you're going to have the top leg, because they're sidelined, the top leg bent over like so. And then that's the recovery position in the quickest way possible that I'm going to show you. And then if you know how to take vitals, keep doing that until 911 shows up, and go from there. So quick recap: signs and symptoms. They may look ill, they have an altered level of consciousness, numbness or tingling on the affected side, difficulties with speech and vision, they may have weakness in one whole half of their body, and they may just appear confused. So hopefully that helps, and you learned something new and interesting. All right, have a good day. Bye, guys.